Hi, my name is Natalie Ciciva, and today I'm going to be performing manual restraints for you. Manual restraints is something that can be used on a horse that is needing vet work or is just genuinely hard to handle. So the first and easiest manual restraint that we use on horses is a halter and a lead rope. It's the easiest form. You put the halter on. You're technically restraining the horse by adding the halter and lead rope so that you are able to move them around. The next manual restraint I'm going to show you is a chain shank. When using a chain shank, it can be used for horses that can be pushy on the ground or are just kind of up and at 'em alive. It's often used kind of at horse shows that a horse is new to the grounds. It can be genuinely spooky, so a chain shank is the first step you're going to take when using the next manual restraint. When doing a chain shank, I'm going to come in from the on side and I'm going to put my chain through the loop, trying to make the least amount of noise with the least amount of vibrations. I'm then going to cross over. I'm going to cross the chain over his nose and go down, out the offside ring from the inside so that there's one loop over the noseband, and then I'm going to clip it with the toggle on the outside. I'm going to come back to this side and I'm going to see that I have too many links sticking out, so I'm going to pull as much chain as I think. You should have about 3 to 4 links left, and I'm going to move it over as I cross back over. I'm going to take the clip, put it through the offside top loop, and I'm going to clip it back to itself with the toggle on the outside. And this would be the correct way to apply a chain shank. The next manual restraint I'm going to show you, well, let's first off take off the chain shank. So when taking it off, you're going to just do the steps, but backwards. You're still going to want to use the least amount of vibration and the least amount of noise. So I'm going to feed it through slowly so that it doesn't make any vibrations. The next manual restraint I'd like to show you is a lip chain. A lip chain can be used for a horse that's bad with clipping or bad with vet work or just needing a little extra help when walking. When doing the lip chain, I'm going to come in from the onside. I'm going to put all of the chain through, not letting him bite it. I'm going to come to the opposite side through the bottom loop and clip to the top loop. I'm then going to straighten everything out. Come back to the onside. I'm going to put all of the links through the bottom hole. I'm then going to make sure my chain is not twisted, and I'm going to slowly push this up underneath his lip so it sits on the gum. I'm going to use downward pressure to hold on to him. Some horses do not like this, as you can tell. To take a lip chain off, I'm going to let go of the pressure, and I'm going to pull it out of his mouth. I'm going to come to the offside. I'm going to unclip it from the top ring, go down through the bottom ring, come back to the onside, and pull the chain out. And that's a lip chain. The next manual restraint I'm going to show you is a lip twine. I prefer to use a lip twine rather than a lip chain, as it applies pressure to a smaller area, which can be a little more aggressive, but is also not the metal. I'm going to be using a cotton piece that has a loop on the end that I'm going to be able to use to attach to the other side of the halter. So I'm going to go to the offside. I'm going to put the loop through the bottom side of the offside of the halter, and I'm going to pull it all the way through so that it's easily attached. I'm going to come back to the onside, go through the bottom hole of the halter, and I'm going to do the same thing as I did with the lip chain. I'm going to raise his upper lip, and I'm going to pull down the lip twine. This can be easier to use as you don't have the extra shank of the chain, and you can be used by one person. So one person could be holding the horse while the other person is doing it, rather than having two. You can use a lip chain by yourself without having the halter. It's just safer to have both of them for you. I'm going to undo the lip twine by letting it go, pulling it through the onside, and taking it off to the offside. If I was going to be clipping a horse, I would prefer to use the next step of manual restraints using a lip twine, going from a halter to a lip twine, as it just kind of gets their attention. So if the horse is bad for clipping their ears, that would be the next step I would take. The next manual restraint I'm going to do is I'm going to apply a twitch. A twitch is not necessarily a step up, but kind of a step up in the fact that when applying a twitch, you're going to take the upper lip and you're actually going to twitch it. You're going to let the horse sit for a minute or two to get the endorphins running, and it's kind of releasing the endorphins to calm the horse down. So when applying the twitch, I'm going to stick 4 fingers through and leave my pinky out, because if I was to put my pinky in, it would be around my wrist and harder to get my hand out. So pinky out, I'm going to take the stick of the twitch and put it under my arm so that it's not swinging around with possibly hitting anyone. I'm going to grab his upper lip. I'm going to use my other hand to move the cord of the twitch. I'm going to use my right hand, and I'm going to slowly twist the twine on the twitch, and I'm going to tighten it until I feel I'm ready to let go, I'm then going to let go and spin it twice more. And this is the proper application of a twitch. As you can tell, he's kind of irritated with it. Give him a minute or two and he'll be relaxed and he will be more willing to just stand here. To take off the twitch, I'm going to use both hands and I'm slowly just going to untwitch. I'm going to let go and I'm going to rub his nose to kind of get the blood flow going back. When using a twitch, you don't want to use it for more than 10 minutes in the fact that too much endorphins can cause the blood flow and it can cause the horse to relax in the beginning, but it can kind of send them over the edge and it could cause the horse to blow up. So 10 minutes is max, and then I'm going to rub the end of the nose just to get the blood flow to come back. The next manual restraint I'm going to do is I'm going to do a shoulder roll. This is quick and easy. It just takes your hand so you wouldn't have to have anything else. So if it was like an emergency situation and you needed to restrain the horse at that moment in time, I would go for the shoulder roll or a leg lift, which I'm going to show you next. For a shoulder roll, I'm going to use one hand. I'm going to grab a chunk of skin and I'm just going to slowly twist it inwards. As you can see, he's pushing away from the fact that I'm rolling his shoulder because he doesn't like it, but it also has gotten his attention and he's currently looking at me. When I'm done with the shoulder roll, I'm going to let go and then I'm going to smooth out the skin to give him the relief of me releasing it. The next manual restraint I'm going to show you is a leg lift. When doing a leg lift, you're wanting to use both hands so that you have the maximum. And I'm going to want to be able to hold the foot because if he gets the foot away from you, then you no longer have control of the leg. So I'm going to bend over. I'm going to pick up his foot and I'm going to grab the bottom of the hoof and the inside of the cannon bone and I'm going to lift upwards. This is the best way to do a leg lift as I'm using both hands and I have control of his hoof. If you were to pull away his hoof, I would still have control as my hand is underneath his hoof. This is another quick and easy manual restraint in the fact that if you wanted to use or do work on another leg, horses will only stand on 3 legs. I mean, some of them will stand on 2, but it's very uncommon. So if I was to pick up this leg lift, I could do work on the right hind leg, and he would be better to work on. The last manual restraint I'm going to talk about is a chemical restraint. A chemical restraint would be something that would be given by your veterinarian. The 3 most common forms of chemical restraint are the sedatives ACE, Rompin, and Dorm. ACE and Rompin are both given in 1 to 2 cc forms, while Dorm is given in 1/4 to 1/2 cc. This would have to be given to the horse via IV route, which means your veterinarian would have to do it. That's the largest and most chemical restraint you're ever going to do. So you could go from something as simple as a halter and a lead rope to a sedative given by your veterinarian.